Good afternoon. Thank you for joining us. My name is Carrie Schreier. I'm an extension educator with MSU Extension's Children and Youth Institute and our Child and Family Development programs, and I will be hosting today. I'm very pleased to welcome Dr. Myerson to join us. So I'll hand things over to him and let him introduce himself before we get going. Dr. Myerson?
All right, sure. Thanks, Carrie. My name is Dr. Josh Myerson. I'm a pediatrician. I live in Petoskey, and I serve as the medical director for 3 local health departments, the Health Department in Northwest Michigan and the District Health Department number 4 on the Northeast side, and then the Benzie Leelanau District Health Department as well. I've been doing this for 22 years now.
Well, great. Thank you for joining us today. We're going to start off our webinar a little bit differently than we typically do, and we have a video we'd like to share. This video is a testimonial from a family who was impacted when their child had flu several years ago. So I'm going to go ahead and hand things over to, here we go with the video.
Vaccines were a priority for our family, and in August of 2017, my son went for a normal checkup. It was a little early to get the vaccine, so we said, we'll just come back. Life happened, we got busy, and we did not go back for the vaccine. Hi, my name is Abby Amesbury, and I live in Boyne City, Michigan. In 2018, my husband and I had a 3-year-old spunky little boy, and we were expecting our daughter. That January, our son was diagnosed with the flu. We had no idea what the flu could actually do. Within 24 hours of him being diagnosed, we had gone to 2 different hospitals because he continued to decline. At 4 in the morning, an air team was called from Helen DeVos Children's Hospital in Grand Rapids. They airlifted our son 3 hours away. They had told us that, don't worry, it'll only be a couple days. My husband and I drove the 3-hour drive to meet him, and by the time we got there, Jace was already hooked up to multiple machines. The next 24 hours, Jace was put on life support. He was put on a ventilator to give his lungs the rest that they needed. That night did not go as smooth as planned. The doctors had to change the vent settings multiple times. They had to change the ventilator that he was on. And the next morning they told us that they needed to do one more adjustment. The next step was to put Jace on ECMO. ECMO is a machine that creates a lung on the outside of the body. This is the most advanced life support there is possible. A procedure that should have only taken a few hours ended up taking 8 hours. Jace was so fragile he was unable to leave the room that he was in. They closed the PICU down and turned it into their own operating room just for our son. Once Jace was on ECMO, he stayed on ECMO for 6 days. He was hooked up to multiple machines helping his body recover. 26 pumps, tubes from everywhere. There was only a small section of his body that we could actually touch while we're in the room. Jace was surrounded by 3 nurses 24/7. We came into his room fully gowned in N95 masks, gowns head to toe, and we had to wash before and after leaving his room. When Jace was removed from ECMO, the doctors noticed that he was not waking up as they hoped he would. From his sedation vacation, the doctors realized that they needed to do further diagnostics to see why he was not waking up. After a stat MRI at 8 p.m. at night, we realized that Jace had suffered a very rare side effect from the flu, one that none of the doctors had ever seen before, called acute necrotizing encephalitis. This had shown permanent brain damage along Jace's brain stem and all over his brain. Because the doctors had never seen this, they started doing research. There was only a survival rate of 30% with kiddos that were diagnosed with acute necrotizing encephalitis. They found that there was a 16-year-old boy in China that had a good outcome from this medication that they were going to try on Jace. Jace was only 3 years old at the time, and they had never used this medication on a child so small. We knew that there was a chance that we were going to harm Jace's kidneys and his liver, but we were going to take that chance because we wanted to see what we could do for our son. After 17 days of being intubated, they removed the tube that Jace was breathing on. Jace slowly started to regain some strength. The doctors were unsure if this was just part of taking him off of the highly sedative medications that he was on, or if he was starting to come back to us. Each day he showed us small signs of improvement. I remember one day that my husband had one of those soft snowballs, and Jace loved to play with those at my parents' house, and he picked the snowball up and he threw it across the room. The doctors couldn't believe it. They kept telling us it was a miracle right before their eyes. Jace was inpatient at Helen DeVos Children's Hospital for over 3 weeks. Our plan was to then go to inpatient rehab at Mary Free Bed in Grand Rapids. We stayed there for an additional 3 weeks, where Jace had to relearn everything over again: eating, talking, sleeping. He had to learn to crawl again. Our biggest hope was for him to be able to eat somewhat thick foods and to crawl when he got home. After 3.5 weeks, Jace was able to walk out of the rehab center with us to go home. My husband and I lived in the hospital for 3 months, him leaving a full-time job behind and me as well. The community stood behind us and supported us. There was multiple benefits that people hosted just for us. Jammies for Jace at school, there was silent auctions. People had taken upon themselves to start donations for us just so Ryan and I could continue to stay by Jace's side in the hospital. I'd love to say that things are back to normal, but for us, it's just a new normal. Jace has multiple appointments on a monthly basis that we have to travel 3 hours away. Hotel rooms, gas, food, it all adds up, and it does create a stress on our life. Jace is legally blind in his left eye because of the damage the virus had caused in his brain. He has severe delays in school, in speech. Jace also has 4 different lung diseases that are directly linked to the battle that he fought 4 years ago. He is undergoing a very invasive medical procedure right now where he receives large doses of high-dose steroids every month. Jace only has 1 more treatment left, and we've already seen a huge improvement now that he's done those treatments. It's a constant battle of making sure that he is safe, that he is healthy, and that he is not showing any signs of respiratory distress. Despite all the support that we had with our communities and the people that supported us during this, I truly wish we never had to experience this. If I could go back in time, would I get him vaccinated? Yes. Do I know if this would have saved all of this from happening? Not 100%, but I don't think it would have been as severe. Prior to Jace getting sick, there was multiple members in our family that did not vaccinate. Since then, because of what they saw him go through, each year we get vaccinated for the flu. If you could only take one thing away from the story that I've shared today, maybe it's having the tough conversation with your doctor, asking about the vaccines. Maybe it's keeping your kiddo home when they're sick. Maybe it's not going to that family event that you're having for the holidays. You never know how you and the germs that you have could be impacting other people.
Wow, that is certainly such a compelling story. And I thank Jace's family for taking the time to share that with us. I am going to go ahead and have a link put in the chat for anybody who is joining us. If you don't mind taking a minute to go ahead and complete your demographic information and let us know who's here, we do appreciate that. And with that, we're going to go ahead and get going with some questions that we have here for Dr. Myerson. You are welcome to go ahead and add your own questions into the chat if you have questions, both in the chat on Zoom, or you can add into the comments on the Facebook section if you have questions that you'd like to share. So our first question here, Dr. Myerson, is about why we have so many respiratory infections that do circulate during these holiday and winter months.
Yeah, sure. Every winter we see many respiratory viruses that circulate, really anywhere in the Northern Hemisphere, certainly in our area. And that's because cold and flu viruses tend to be more common in the winter months when the temperatures drop and we gather indoors. So that's when they tend to be more common. And holiday season specifically can magnify that because we increase our time that we spend with different groups. There's more traveling, there's more mixing of people. And so we see increases in respiratory infections every year this time of year. Right.
Our next question is about family coming to visit during the holiday. And this person shared, they have family coming in to visit during the holidays, and they're worried about what they can do to help protect their family from respiratory infections. And this particular person shares that they have a baby at home, as well as an elderly parent who lives with them. And they're concerned, I think, about the germs that could be brought into their home when they're gathering and meeting with people during the holidays.
Right. And Jace's mom in that video, kind of spoke to that. And when as a physician or someone advising people, if your child or if you get the flu, I'm going to try to reassure you that most people get over it just fine, but not everybody is that lucky, and we can see that the consequences can just be devastating for families and for little kiddos and the challenges that Jace faces. So if we can do something to reduce those risks, of course we want to do that. So with the holiday season, upon us here, most colds and respiratory viruses spread through droplets that are transmitted when we speak, when we cough, sneeze. It comes out and it can go into the air. It can get onto surfaces. And really getting vaccinated against two of the most severe viruses, the flu or influenza or the COVID-19 boosters, is the best way to reduce your risk and protect your family. There's other important steps you can take, especially for many viruses. There isn't a vaccine like RSV. There are no vaccines. So other things you can do is just encouraging people to stay home if they have just come down with something. They feel like they're coming down with something. You have a fever. You just started coughing and sneezing. It's just good to stay home. Other things you can do: washing your hands, especially before you eat. Coughing into your sleeve or elbow instead of into your hands helps you reduce how much you might spread it. Not sharing cups or utensils. And then, just cleaning. You don't need to go crazy with cleaning, but especially cleaning those high touch surfaces such as doorknobs, mobile devices, and other things that we touch a lot can help reduce the spread as well.
Yeah. And last week, or our last webinar like this, we welcomed on a guest who was able to talk to us a little bit too about family norms and how do we establish these family norms to talk to people ahead of time. So we have a joint understanding about who's coming, what symptoms would cause you to stay home and why would you want to stay home if that happens. I know it can be hard for people to make that decision to miss a holiday gathering, especially when we haven't been able to get together these last few years, but it's important, right, that we're setting those guidelines and not coming if we're not feeling really well.
Right.
Yeah. So our next question, and you had just touched on this, and we certainly saw this in Jason's video, but the person is asking here how important vaccination is when it comes to these respiratory infections.
Yeah, getting up to date with your COVID boosters, your COVID vaccines, getting your flu vaccine every year. Everyone 6 months and older every year should get a flu shot. And those really are one of the best things you can do to stay healthy this winter.
Seems like you can find those vaccines pretty readily in our community these days.
Yeah.
Okay. And speaking of vaccines and when we get them, our next question is about those COVID and flu vaccines and if they can be given at the same time or if it's best to separate them.
Yeah, good question. And absolutely, you can safely and effectively get both of those vaccines and other vaccines as well at the same time. It's going to save you time. It's going to make it easier for you, kind of one-stop shopping. So getting both of them at the same time is just a great time saver for sure.
Yeah, and it's nice now that they are available so readily. I was in Target the other day and they were standing out in the aisle offering to come back to their clinic and get their vaccines. Your vaccine's just right there on the spot, which certainly makes things easier for us as busy parents and families to not have to make that extra stop.
For sure. And at our local health departments, we're giving a lot of COVID and flu vaccines out to many people at the same time. And they're just happy they can get it done and get on their way.
Yep, definitely. Our next question here is about telling that the difference between COVID, RSV, and the flu. And I know my niece, for instance, had a couple respiratory infections this fall, and the symptoms are so similar. It can be hard to tell at the outset whether you have COVID, RSV, or the flu. How can you tell those apart?
Yeah, they're all respiratory viruses, and they can have slightly different presentations, slight differences in their symptoms, but for the most part, they're very similar. And without laboratory tests, it's really difficult to tell or to know for sure. They can all cause the fever, the aches, the cough, the congestion, and lead to difficulty breathing that would be of concern. For most people and in most situations, though, we treat them all the same with the kind of general home care and the same recommendations. So for many people, it's not that important to know the difference.
Okay. So speaking of RSV, we've heard a lot of talk this cold season about RSV and how there's a more seems to be more RSV around in the community. Could you talk a little bit about what RSV is and why it's so dangerous for babies?
RSV is a respiratory syncytial virus, RSV for short. It's a very common virus that almost all of us are infected with probably several times throughout our life. Most children have been infected at least once by age 2. For older children and adults, it generally just causes a bad cold with a lot of upper respiratory symptoms, congestion and, a plugged up nose and a cough, just a bad cold. But in infants and toddlers, especially, young children with underlying heart disease or lung disease or other medical problems that put them at increased risk for respiratory disease, it can lead to lower respiratory symptoms such as, bronchitis, bronchiolitis, pneumonias that leads to wheezing and difficulty breathing. So especially, babies who are born prematurely again, or children with asthma or things, it can be, especially dangerous. And many of our young children with these underlying risk factors end up needing to be hospitalized for supportive care for oxygen or IV fluids for several days.
Yeah, it certainly sounds like it's very serious. And I know we've had that experience in our family as well. Do adults get RSV?
Certainly, we all can. And again, most of us get colds. I think as people get older, or if they, for people who are also have high risk medical conditions, they can also suffer lower respiratory symptoms and get really sick from RSV as well. But again, primarily the age group that we're concerned of are infants and young children.
Okay. So I've heard talk in the media there being a tridemic or a tripledemic this year with a surge in RSV and then COVID and flu at the same time. Is there a reason to think that we are having this sort of tripledemic?
Yeah, I think, certainly the media that plays well, right? That gets you to click. It's the tridemic or whatnot. But, some of the reasons for that is that, because of the COVID measures that we took the last 2 years, many of our young children went without getting the typical infections that they usually get. There was very little RSV activity or influenza activity the last 2 years, which is really very unusual. So this year, our susceptibility for these infections is up because our overall immunity is down. And that's where that concern of that tridemic of having the COVID, the flu, and the RSV coming at surging at us all in the same time. So far this year, we saw an early and an elevated surge in RSV infections. Our hospitalizations were definitely up. Our pediatric and our ICUs and hospital beds were strained for sure. And our influenza cases and COVID cases are ticking upwards right now in the state of Michigan in the last few weeks. So, it is concerning because there's only so many hospital beds, and probably more importantly, there's only so many doctors and nurses to take care of us, and our healthcare systems are strained. So I think that's where the concern is. On the other hand, I think RSV may have already peaked this year. I hope so. There's some signs that it may have already peaked, and hopefully the peaks of flu and COVID will be far enough apart so as not to overwhelm our hardworking healthcare workers. So certainly we are going to see surges of flu and COVID coming up here this winter, and how it plays out, we don't know for sure. But getting vaccinated can help take some of the strain by reducing the number of people that are sick enough to need those hospital beds. So, getting as many people vaccinated against these illnesses is one of the best ways we can try to prevent or reduce this potential for multiple epidemics going on at the same time.
Yeah, definitely. Are we likely to continue to see this sort of peak of RSV season, the peak of RSV coming around the same time as COVID and flu?
Well, RSV peaks, pretty much the last 2 years were unusual. We get an epidemic of RSV every year, and just like flu, it can come around different times of the year. So, often RSV and flu tend to be a little bit out of sync per se, usually RSV coming before, but they certainly can surge at the very same time because they they really are respiratory viruses that spread more easily in the winter months.
Yeah, we certainly do seem like we're seeing a lot of it these days. As a mom with kids in the schools, I feel like we constantly are having friends
Right.
that are sick or people that are exposed to things right now. So on that subject of things being, a little different than they have been the last few years, I know that we're seeing fewer and fewer masks being worn, generally speaking. And this, about this time last year and the year before, we were encouraging everybody to wear masks during family gatherings, to test before they came to family gatherings. I know we had I had friends who didn't send their kids to school the week before Christmas because they wanted to make sure that they didn't get exposed to COVID and weren't quarantined during Christmas. Are we still supposed to be taking these sorts of measures, masking during family gatherings, testing before we come, those kinds of things?
Those are good questions and good things to think about. One thing that we learned from COVID and from going through this pandemic is that those social distancing, keeping sick people home, the isolation in the first days of illness, wearing a mask, those non-pharmaceutical interventions, they work to reduce disease transmission. So, masking when you're in an indoor gathering, especially with a lot of other people, can help reduce your risk of becoming infected as well as your risk of getting other people around you sick if you happen to be spreading the virus and not even know it. So, with that said, every person and every family is unique, and each of us, should be comfortable making the decision based on those unique perspectives of our health, our loved ones' health, the people around us. And so I think these are decisions that families should be open about discussing and just deciding what's going to work best for that family and that gathering. And I think, making sure that everyone, has that respect for each other, they can come to those decisions that work best for each family.
Yeah, I know I mentioned earlier, we had a guest expert on for our November webinar shortly before Thanksgiving, who was talking a lot about how we have these tough conversations as families and making sure that these are conversations we have in advance of the holiday and not waiting until you walk in the door and then you're suddenly asking everybody to mask, or, having that conversation in advance about what symptoms would make you want to have somebody stay home, and what are you looking for? I know many of us I have kids that just will have stuffy noses for much of the winter here. So it can be challenging to know if they're sick or if they just have a runny nose. What mark is the sick enough to not come together mark? And the social worker we had on last week was really great about, I keep saying last webinar was really great about talking us through kind of thinking through those what that mark is for each family and what risk level we're willing to tolerate as a family in order to still gather, and how we set those guidelines, but making sure we do it in advance of the gathering and not waiting until you're right there at the door and then discover that little Johnny has had a temperature this whole week and
yeah, absolutely
couldn't miss Christmas, right?
Mm-hmm.
Yeah, it can be challenging. It was challenging before COVID sometimes to navigate these things as a family. And this certainly adds a whole nother layer to think about.
Yeah, it does. It gets more complicated.
It sure is. And family gatherings can be complicated enough. All right. So what are your, if you were to give just those top recommendations to avoid getting a respiratory illness this holiday season, what would you encourage people to do?
First and foremost, get your flu shot, get the new bivalent booster. That's really the first and easiest thing to do. Other things that are important, washing your hands, especially before you eat. It's hard, but try not to touch your eyes or mouth with your hands, can help reduce that transmission. And, again, picking, if you're real concerned or if you're real high risk, it might be worth going places when it's less crowded or wearing a mask. Again, for everyone, what's acceptable risk is something that they have to take. But, you can lower your risk, of getting severely ill by getting vaccinated.
Great. Thank you. So our next question here, and I do want to remind people that you're welcome to go ahead and add your own questions in the chat or Q&A if you have any questions. But the next question we had previously submitted was about when the timing of vaccination. So if people haven't gotten vaccinated yet, we're what, about 3 weeks to go till Christmas here. Is it too late to get vaccinated if you would like to get vaccinated before family gatherings? Is there timing that people should be taking into account here?
Ideally, that 2-week time frame maximizes the time for your immune system defenses to be prepared to mount the best immune response. But your immune system starts responding, almost immediately, and some protection occurs within even a few days. So I would tell you, ideally, to get it at least 2 weeks. The best time to get a flu shot, if you haven't had one yet, is today. But that said, anytime you can get it, it's really not too late to get it. And even if it's just a few days before a gathering, you'd be better off doing it than not doing it.
Typically in an average fall, when do we recommend that people get their flu shot?
Really September, October, because influenza can start circulating. We've seen it as early as October. It usually peaks up here in February, but every year can be a little different. So, I think, really fall is the best time to get the influenza vaccine.
But if you haven't, now is the time to get out and get that done.
Absolutely.
Yeah, great. I know, over the course of the last couple years, we've talked a lot about limiting sizes of gatherings and not being in large groups. Should we limit the size of our family gatherings this holiday season?
That's, similar to the other things we were talking about. It's a tough question. Really, each family needs to decide, based on their unique makeup and the thinking of the needs of all of their loved ones. If you have particularly vulnerable people in your family, you may want to, make that circle a little bit smaller. Some families are, have these, wonderful large families, and people are healthy, and maybe they have the space and the way to do that. And I wouldn't want to leave people out of a family gathering unnecessarily. So something really that you need to kind of just think about in advance.
Sure. Yeah. It can be tough to make those decisions. And as we've seen these last few years, right, I think everybody's ready to get back together and to celebrate Christmas, and not feeling like they want to have Christmas gatherings put on hold this year.
Yeah, for sure. It's important.
So when we think about vaccinations, is it just as important for kids to be getting vaccinated against COVID and flu as it is for adults, or does one group matter more to be getting vaccinated?
It's important that everyone get the vaccines that are recommended for them based on their age group or their particular, medical conditions. But it's also, while we've seen, even if some age groups, are much less likely to get severely ill, anyone can get severely ill from these viruses. Yeah. And we also know, for instance, with flu, that flu vaccines will help protect our most vulnerable people, our elders, our grandparents, our seniors, our adults with severe medical conditions that put them at increased risk. So the vaccine is going to help them, but unfortunately for many of them, many of our most vulnerable people, our oldest family members, our sickest and most frail people, they just don't make a strong response to the vaccine. We still recommend it for them, but the honest truth is it is not as effective for them as it is for healthy individuals and younger individuals. So it's equally important that you get everyone around them vaccinated. And doing so, vaccinating the people around individuals in a nursing home, for instance, reduces their risk of catching that virus because the people around them are less likely to give it to them. So really, when you're looking at different groups of people, the best way to reduce everyone's risk is to get everyone vaccinated.
Sure, that makes sense. So if with all these respiratory illnesses we do have around in our community right now, if you're getting sick, you're coughing, have those respiratory illnesses, do you need to go see a doctor, or is it something you can stay home and just wait out?
Most of us, who get upper respiratory infections like colds and flus really can manage their illness at home. And we don't need to go to the doctor or go to the, hospital or emergency room. And really it's best to keep the ERs open for those who whose needs are really emergent. Our ERs have been really, really busy these last few years. Staying home if you have fever and while your illness in those first few days of your illness as it's progressing can help stop the spread to other people. I think concerning signs that if you're having trouble keeping fluids down, or you're having difficulty breathing, catching your breath, or if it's been several days and you're just not getting better, or new or worrisome symptoms show up, then certainly you should contact your doctor, and you might need to be seen, or your child might need to be seen. But most of us can manage these infections at home.
So on that subject of having these illnesses, what if you do have a respiratory illness, or if your child has a respiratory illness, at what point should they get tested? Do they need to get tested to see what it is? Does it matter if we know what it is?
Sometimes, but most of us, again, because we manage these things, at home, and the treatment really doesn't vary that much, it's not that important to get tested. Where it can be important is if the symptoms are severe enough that you're going in to see the doctor, or again, if maybe someone in your family who might be exposed, who's been exposed to that infectious process, is at high risk. It can be helpful to know what you're dealing with, because for instance, if it's flu, there's specific medications we can use to treat that flu for people who require that. There's anti-flu medications, antivirals, and there's different medications we can treat COVID with. And that really can be life-saving for people at risk of severe COVID if they do get infected, to start that medication early. So if you have individuals at high risk, testing to know how to best treat it can be really helpful. But again, in situations where you don't have those sorts of scenarios playing out, it doesn't matter that much, because again, those that are fortunate enough to be young and healthy, we don't generally need those medications, so it really doesn't matter as much. So not everyone needs to get tested, for sure.
I know when my niece recently was sick, they didn't recommend that she go in and get tested right away. But when she wasn't getting better over, a period of a week or so, she was continuing to be pretty sick. At that point, they did recommend that she went in and get tested.
Exactly.
And then we found out she had RSV. So there was that juggling act of waiting, when do you take them in to get tested, and how sick is too sick? And those can all be a lot of things for parents to weigh when they're deciding how to approach these things. So, we've heard a lot of talk about COVID vaccines and flu vaccines, but one of the things that I haven't heard about, or I don't know much about, is a vaccine for RSV. Is there one being developed? There's not currently one, I don't believe.
Right, there is not. Vaccines for RSV have long been sought after, because this is a virus that has caused serious infections and claimed the lives of our most precious youngest children and our infants. So there are vaccines that are being developed and tested. Currently, there's some that have actually been progressing through the testing process, but there's no RSV vaccine that is currently ready for approval. And, like all vaccines, it's really important that they're shown to be, safe and shown to be effective before we start using them. So certainly we'd all be really happy if we had a good vaccine for RSV, and I'm hopeful that we will have one, but right now there is no RSV vaccine available.
Okay, good to know. On that vaccine subject, I know one of the reasons many people say they don't want to get the flu shot is that they think they will, or say that they've gotten the flu from the flu shot. Can you get the flu from the flu shot?
Yeah, it's a good question. And simply put, no. The answer is no. Some people, you can get the flu shot and come down with the flu in the 2 or 3 days afterwards, because, it can take several weeks to develop full immunity. Some people might feel a sore arm or a little achy after getting an immunization, but that's not the flu. You can't get the flu from the flu shot because it's not a live virus vaccine. So it can't cause an infection. It's just, you can't get the flu from the vaccine.
When we're making these decisions, I know it's something that people often cite as a concern. So it's good to know that definitively we can't do that. And then on the subject of the COVID vaccines, can anybody get the bivalent booster that's available right now?
For the most part, yeah. Anyone right now 5 years and older can get their age-appropriate bivalent booster dose. And likely there's going to be approval of that bivalent vaccine for use in our youngest children soon as well. So the guidelines right now, really, anyone who hasn't had a bivalent booster that is eligible for it can, and I would recommend they get one. Generally, it's recommended that you wait 2 months since your previous COVID vaccine. So if you had the original COVID vaccine in the 2 months prior, you should wait 2 months before you get that bivalent booster. It's only a single booster dose right now. So once you've had one bivalent booster, you're done. You don't need to get a second one. And the other is people who have recently been infected with COVID and had COVID illness may also want to delay or defer getting that booster for 3 months before getting it, just to kind of maximize their benefit. They can get it earlier if they want, but kind of my general recommendation is to maybe wait 2 or 3 months. But all of us can get it. And I think our uptake has not been as strong as I'd like to see in the state of Michigan. There's still a lot of even adults, even older adults who could get the booster who haven't yet. And I really would urge them to think about now is a good time to do it. We are seeing COVID rates increase in the state, and I don't think you really want to wait any longer.
Yeah, I think many of us have gotten to be so used to COVID being around, it maybe isn't.
And unfortunately, people, you can get, just because you had it once doesn't mean you can't get it again. I think we all know people now who have had COVID 2 or even 3 times, and they get just as sick again. So.
Yeah. And in fact, that's our very next question is, what would you tell somebody who, says, well, they've already had COVID, and so they feel like they don't need to get the vaccine, or they don't need the bivalent booster because they already had COVID?
Yeah. Again, it's a good question, but you certainly, because you've been infected with COVID, the COVID virus, we do not make a lasting immunity to it. So you can get it again. And with the newer variants, you are likely to be reinfected. So I think you can get it. Should you wait? I think that's an important question. And generally, I recommend waiting 2 to 3 months after your COVID infection to get the booster to maximize that benefit. And the reason for that is it's unlikely that you'll get COVID in that couple months after you've already had it. Although I've heard people who've come down sick and tested positive, in rapid succession. You can get it as soon as after you've recovered from COVID. So once you're fully recovered and you're not contagious, you're eligible to get the booster. People may not want to wait those 2 to 3 months if they have a big trip planned, if they're going to be, on the road for a long time, or traveling where it'd be hard to get the booster, or they're visiting a bunch of family members that are scheduled in that time frame. Then they might not want to wait and get it earlier, and that's okay too.
Great. When all this talk of flu shots and COVID boosters and when we're supposed to get them, is there a possibility that they will come up with a combined booster for all of these respiratory illnesses, that we might be able to just, one and done and not have to worry about scheduling everything?
Yeah, that would be great, wouldn't it? And I remember talking about, or oral vaccines where it was simple as eating a banana or something. But for a lot of reasons, combining things, we do have combination vaccines, like with our children, where they get protected against many viruses with a single injection, like the MMR vaccine, or the combination vaccines we give our infants. But I've not heard of combining flu and COVID vaccines. I think that's something that could happen down the road, and we'd all be happy if they worked. But right now, it's going to be separate folks.
2 separate ones for the time being.
Yeah.
When we are making these decisions as parents to send kids to school with symptoms, it can be so challenging for parents to just, tease out when they should send them to school and when they shouldn't. And I know for the last couple of years, there were really strict guidelines to not send kids with any symptoms at all. But now we're kind of turning a little bit of a corner here, where we're back to attendance policies at school. And as a parent of 4 kids, I know I struggle with knowing if they're how sick is too sick to go to school? And what are your recommendations in terms of when we send kids to school, and with what symptoms they can still go to school, or when they should definitely be home?
For most infections, children, are most, and all of us are most contagious in those first few days of illness. So that's when they're sickest, and even, the day before the symptoms start, and then those next few days. So for that reason, the general guidelines for most respiratory infections, when you're talking about returning to school or daycare or work for that matter, but especially with kids, it's to keep those kids home while they have fever, for sure, until they've been fever free for 24 hours. And then once they're, and waiting until their symptoms have improved enough that they can productively participate in school activities. So they should be feeling better. They don't have to have their symptoms resolved, but they should be like, things are getting better, they're on the mend, and they haven't had fever. They can then return to school or daycare, even if their symptoms haven't resolved. And that's, kids, especially, they can cough for several weeks following infections like RSV. You can have a cough for many days afterwards. And we need to balance, the disease control efforts with meeting the social and educational needs of all our children and the needs of our families as well. So, I think kids don't have to be completely better. It was a little different when COVID was out and we were really trying to do things to manage a pandemic. We're in a different place right now, and we shouldn't shame families for sending kids to school when they meet those criteria to return. The other thing is our schools really have worked really hard in the last few years to up their hygiene practices at school, and they've done a lot to help promote healthy environments in the building with regular cleaning and encouraging hand washing or hand sanitizer and just making everyday activities to help reduce the spread. So I think those are all positive things that are going to reduce infections from all sorts of different viruses.
Yeah, it's so tricky as a parent to balance, your needs as a parent to go to work and to meet your own personal obligations with, having kids who just take some time to get over these illnesses and perhaps are still coughing, like you said, or have a runny nose. Mm-hmm. It's tricky as a parent to know what to do these days.
Right.
Our next question came in over chat here. So somebody is wondering about the flu shot, and this person shared that they've never had the flu before, and so they don't feel like they need to get a flu shot. Could you talk a little bit about why somebody should get the flu shot if they haven't ever had the flu in the past?
Not everyone gets the flu every year. A lot of us don't, and that's great. Some people are certainly maybe less likely because they don't have as much exposure to it. If maybe they work from home and they don't get out much or whatnot. But just because you haven't gotten the flu in the past certainly doesn't mean that you can't get it in the future. I think all of us who are exposed to the flu and not immune to it are susceptible to getting it. So I think all of us can get the flu. And again, many of us just have been fortunate to not get it. Some people I think, most people don't get influenza every year the way they will get different colds every year, but, it's no fun when you do get it. So why I'd recommend that you get vaccinated is you haven't had it. I mean, especially if you haven't had the flu in the past years, you probably don't have a lot of immunity because it does wane over time, and the flu virus mutates every year, and we get different strains, and we formulate the flu vaccine every year, trying to match those with what's going to be circulating in the environment. So I don't think any of us are innately immune to being infected. So I'd recommend you get the vaccine, because although you may not get it, this is just going to reduce your risk that much more. It's going to reduce your risk of getting it, or if you do get it, you're going to have much milder symptoms. And I think if that means fewer days in bed, fewer days missing work, fewer days missing school, fewer days feeling miserable, that's something I would recommend taking those steps to do that.
Are there any groups of people that shouldn't be getting the flu vaccine? Or are there allergy? I know I remember hearing concerns about egg allergies.
Yeah, egg allergies really is interesting. We've learned that, because the flu vaccine is made with eggs and things, so that's where that concern came up. But we know now that even people with severe egg allergies can safely get the flu vaccine. So when you're looking at the flu shot, there are very few people who can't get the flu vaccine, and pretty much everyone 6 months of age and older, I recommend get it. There's a few people, if they've had a serious reaction to a prior flu vaccine or develop something like Guillain-Barré syndrome within the 6 weeks of getting a flu vaccine, those are things they should talk to their doctor about that. But on the whole, there's very, very few people who can't safely get a flu shot to protect themselves.
Now, there is a nasal spray option.
Yeah,
correct?
and there is the flu mist, the nasal flu, and that's a little different. That's a great option for people who don't like needles or for young kids. But that is an attenuated live virus vaccine. So people who are immunocompromised or pregnant women should not get the flu mist, the nasal flu, because it's live virus. But they can safely get the flu shot because it's not a live virus. So even immunocompromised people and especially pregnant women should get the flu vaccine every year.
Great. Yeah, I remember my dad had a kidney transplant actually, and I remember going through this with him and his not being able to get that live virus vaccine at that point in time.
Exactly.
Yeah. So our next question here is about kids in childcare again, and I know we all struggle with this. This person shares that their child has been in childcare this fall and has been persistently sick, just virus after virus after virus. And I know it's certainly, we've seen this with my niece this fall. She had a bad cold. She had RSV. She's got a stomach bug right now. Should parents be considering pulling their kids out of childcare at this point? I mean, if we have all this exposure to these viruses, is there value in just kind of getting them out of the programs for a little while?
That's a good question, Carrie. And I've heard that a lot from, frustrated families, worried families. I think one thing to remember is that many children routinely become infected with many different cold viruses every year. The last couple of years have been unique and unusual, but, typically, on average, toddlers and young children average 6 to 8 colds a year, and they can last a few weeks. And what that translates to is that many of our kids, are going to have a runny nose, a snotty nose, basically pretty much from November to April. And that's not unusual. It's actually fairly common. And if that child is otherwise healthy, happy, doing well, there really is not a need to pull them out of an environment that can provide many benefits to them, and their families. We get a lot of benefits from that social interaction. Some children who maybe are at higher risk have a lot of underlying medical problems that, the decision can get a little more complicated. And that's really something where it needs, careful thought. And really that's something to discuss with your doctor for sure, looking at the risks and the benefits of that. But for children who are otherwise healthy, it's really not unusual and really pretty typical that they have a runny nose all winter long.
Yeah, I it's interesting with the way things have gone these past few years. We just haven't seen so many of these normal cold viruses around. It does feel like it's so much more right now, I think, than it has in the past. But I know as a previous preschool teacher, we certainly had cold viruses constantly circulating in our early childhood environments. And now we have kids who
certainly we're, the kids they're more susceptible probably because they haven't been infected with them. So, are we seeing more of it this year? I think certainly anecdotally, that's what we're seeing. And with things like RSV, we're seeing more too. For most kids, they're getting through it just fine.
All right. So our next question here is about, again, going on the flu vaccine subject. Is there like a stronger or super flu vaccine for seniors or for immune compromised people?
That is a good point to bring up. It's really, there are some vaccines that are authorized for use in older individuals, and older, I mean 65 years and older. And there's a high dose flu vaccine and an adjuvanted flu vaccine. So there's actually 3 different brands out there that are approved for use and recommended preferentially for people 65 years and older. So although someone, if you're over 65, you can get any of the licensed flu vaccines that are approved for use. But the preference is that if you're able to get one of these higher dose flu vaccines, to get those, we talk about it being a senior flu vaccine. And that goes back to what I talked about earlier, in that the older you get, you just don't respond as well to vaccines in general. So giving seniors a higher dose seems to help improve the effectiveness of that vaccine by stimulating a better, they just need a little more to get their immune system going. And so that's where that thought process and why that preference for those products for the seniors has come to be. And hopefully it will translate to, lower risk for them.
The opposite end of that spectrum, we have a question about children with asthma and how, what the question reads, my child has asthma, what should I do about immunizations? Are there any specific things to be taken into account?
Asthma or other lung problems or heart problems or kids who have to take medications that might reduce their immune system's ability to fight infections. They might be taking, medications for all sorts of different chronic illnesses. But, asthma is an example of that. Kids with asthma are at increased risk of getting really sick from colds, from RSV, from flus, from pneumonias, whooping cough, and many other respiratory infections. And, for this reason, it's really important that it's even more important for kids with asthma to be up to date on all the recommended vaccines. I think they're more at risk, and therefore I would even, I recommend all kids get all of the recommended vaccines on time, but it's even more important for our kids with asthma and other medical conditions like that.
We have one last question, and then we'll be wrapping things up for the day. This last question is about at what point, with what temperatures or what symptoms should parents be taking their kids into the doctor? We've talked some about home care and whether or not we need to test. What are those signs that now is really the time that you should be seeking care for your child when they have one of these respiratory illnesses?
Certainly, I don't generally talk about a specific temperature, a fever of 100.4 or higher. Some kids are 101, some kids might be 102 or even 103. You can run high fevers with influenza. And the level of the temperature isn't as important to me is how that child's acting and responding. A child with 101 fever can be more trouble than a kid with the 103 fever. So the number isn't as important to me as how that child's doing. And certainly, if you think they're having difficulty breathing, if they're having to breathe really rapidly or shallowly, or, you can tell they're just having trouble getting air in and out of their lungs, they need to get seen right away. If they are showing signs of dehydration, they just can't take fluids in, they're coughing so much that they're throwing up and they're not able to hold liquids down, then, and especially as the younger they are, they can really get in trouble with dehydration that much quicker, and they need to be seen for sure. And then really, parents, and moms have great instincts, and they should trust those. If something just doesn't seem right with your kiddo, then by all means, at least call your doctor and talk it over with your doctor's office about getting seen. And again, if something is really worrisome, then you need to get them seen, and I would trust your instincts there. For children with a fever, and you give them some Tylenol or some acetaminophen or ibuprofen, brings their temperature down a little bit, and they can get comfortable. They can drink some, keep some liquids down, and they're comfortable, even if they maybe aren't full of energy, but they can hang out and be comfortable in your arms or in bed or on the couch next to you, then they probably don't need to get seen right away.
Well, great. Thank you so much for your spending the time with us here today. Do you have any follow-up, any wrap-up information you'd like to share?
I think we covered a lot of things, and maybe one of the main kind of themes is that, people, we're all concerned about getting infected, and especially with our children, we want to, avoid all risk, really, because our kids are so precious. And so we all look at trying to avoid that risk, whether it's, from the risk of being infected, or some families are concerned about, vaccine safety. And for both of those groups of people, I try to remind people that we can't avoid all risk. We can only take steps to reduce risk. We don't want to live in a completely closed bubble. We want our kids to have social interactions. It's critical for their growth and development and our personal fulfillment. These things are important as we come out of our houses here, and it's really that it's equally important in our overall health. So when we're talking about respiratory viruses, they're a fact of life. RSV and influenza have circulated every winter for forever, basically, certainly as long as I've been around, and COVID-19 is not going away either. So until we have ways to eradicate them, and I would be the first one to cheer if we one day when we're able to, we all need to learn to live with these viruses. It happens every year, but at the same time, we can take steps to reduce our risk, not eliminate our risk, but to reduce our risk, not just for us, but for our family members and our loved ones, and really our whole communities. So, what can we do? And really the main message for me, I guess, would be that, getting a flu shot every year and keeping up to date with your COVID vaccine boosters, with all your recommended vaccines, and then taking those simple precautions that we've talked about can reduce your risk and allow us to, at the same time, to participate in, all the moments of life, that bring us joy and fulfillment, especially, here we're entering the holiday season.
Again, want to thank you, Dr. Myerson, for taking the time to be with us today. And I'd like to thank Jace's family for sharing that very compelling story about Jace's health. And I hope and wish him and his family well as they enter this upcoming respiratory season again.
Yeah, for sure.